just look at a few scenarios. I don't know how you are sitting and how best you want us to discuss this, but I'm just going to read and we can, whoever has ideas, just raise up your hand and give us the answer. So the first scenario is a female, 37 years, admitted to an emergency room with generalized edema, exertional dyspnea, and ascites. Her blood pressure was 150 over 100 millimeters of mercury. She had increased cardiac dullness with 80 beats per minute, and the liver was enlarged 5 fingers below the costal border. For a few years, she was being treated for chronic glomerulonephritis. With the treatment, her health situation improved a little, with the blood pressure oscillating between 150 to 180 over 100 to 120. After 1 month, her health situation deteriorated, and she died in 1 week with acute pulmonary edema. From this scenario, this is not a pregnant mother, but that's just to try to put to context what we have learned. What will be the immediate cause of death in this case? You can just put up your hand, or you just speak. What to you will be the immediate cause of death? The immediate cause of death, what will you put in line A of the medical certificate of cause of death form?
Acute pulmonary edema.
Acute pulmonary edema. Okay. Yes. So what will you put in line B? What will go under line B?
Hypertension following kidney disease.
Hypertension?
Yeah.
Okay.
Chronic.
Okay. Then what will go in line C?
Chronic
kidney disease.
Chronic kidney disease.
Chronic kidney disease. Okay. Okay, chronic glomerulonephritis. Okay, and any other information that you want to capture? Okay, let us see what we'll have. You will have clear examples with maternal deaths. So in this case, so here you can just have, you can have the immediate cause of death can be hypertension.
Hypertension is up.
Is that correct?
No.
No. Excellent.
No. Yes.
Okay, so you'll have something like this. So you are right. Acute pulmonary edema. You can have hypertensive cardiomyopathy. This is, and then you have underlying cause as chronic glomerulonephritis. You can have something like this, right?
Yes.
So it is just try to get the basic principles, try to get the basic principles and how to code. And it's actually easier if you have attended to the patient. Actually filling in the death certificate can actually be much easier. I see somebody using a Huawei raised the hand, Jira 2017. Go ahead. Somebody using a phone, Huawei, or you have lowered your hand. Okay, I'll go on. The next scenario is now for a pregnant mother. This one now I expect you to give me the correct answer here. A 27-year-old pregnant woman was brought to the casualty ward after being knocked by a speeding car 20 minutes earlier. She was bleeding profusely from an open wound in her head and other parts of her body. She was immediately attended to by a doctor on duty. The attending doctor also noted that she sustained multiple fractures in her upper and lower limbs and also ribs. She died 25 minutes after arrival at the casualty ward. So, who can give me the sequence of events that led to death? The immediate, intermediate, underlying, and so on. 1 minute to try to organize your thoughts, and then another minute to discuss. Just look at it, try to write it down, the sequence of events that we think led to the death of this mother. Anyone ready can raise your hand or just speak up. Yes, Masua, Dr. Masua. Dr. Masua, go ahead.
I think the underlying cause would be hemorrhage, severe hemorrhage.
Mm-hmm.
That was secondary to severe multiple fractures
Mm-hmm.
that were sustained as a result of an RTA.
Okay.
And then also, of course, we can note that the woman was also pregnant.
Okay. So how about the duration, the interval from onset? Can you attach the intervals?
Oh, it's about 20 minutes. No,
20 minutes for
45 minutes, about 45 minutes. But
Yeah.
it's unknown how far before the accident.
Yeah, so the immediate cause is how many minutes?
Hello?
Immediate cause. How many minutes do you put against immediate cause of death? If you said that was severe hemorrhage.
Okay, that's tricky. Maybe 10, because you can bleed maybe about 2 liters. I don't know. Just
Why 10? Why 10 minutes? I'm talking about the time interval.
But we
Yes.
have 20 minutes and we have another 25.
Yes. So what's the
They
interval?
knocked her 20 minutes.
Uh-huh.
45 minutes.
And then she came in and died after 25.
Yes.
So she had a total of 45.
Okay. So I see 2 raised hands. Hillary, who are the 3 hands? Who are the participants that have raised their hands?
There is Aino Boni.
Okay, Olive, go ahead.
Aino,
Aino,
and then
go ahead.
Agnes.
Okay, can I go first?
Okay,
So
go
I
ahead.
think it's 45 minutes because this person was knocked 20 minutes before they came to the hospital. That means the time they had an accident, they actually started hemorrhaging. So
Yeah.
even on arrival at the hospital, 20 minutes later, I think they were still bleeding. That makes it 45 minutes.
Okay.
Thank you, over.
Thank you. Thank you. Was that Mama Gembe?
Yes.
Okay. Thank you, Agnes. Any other?
There is
thoughts?
Dr. Masua. I don't know whether it's a new hand or an old
Okay.
one.
Okay, Dr. Matua, go
Masua.
ahead.
I think he spoke earlier on, so I just don't know.
Okay. Sorry, it's an odd hand. So I think I
Okay.
agree with the question wasn't clear. I think I agree with the 45 minutes.
Excellent. Okay, so let's look at what we put down. So severe bleeding for the 5 minutes, correct. Multiple injuries for the 5 minutes, knocked by a speeding car for the 5 minutes. And then in frame B, we need to complete the section where the surgery was completed. Of course, surgery was not completed, but there's something I want us to discuss. Now, let's look at the surgery. Was surgery completed here? You said no. Then the other one was,
unknown.
was any autopsy requested? No. Man of death and accident. Then date of inquiry, or rather date of injury, you need to fill that. Okay. Then please describe how external cause occurred. So you just describe from maybe people who brought her, maybe she was knocked while crossing the road or whatever it was happening. You need to record it there. Now she was knocked by a speeding car while crossing the road. Then place of occurrence, a street and a highway. So they give you these options just to circle. Then for women, was the disease pregnant? Of course, yes, she was pregnant. Now there's one thing here. Did the pregnancy contribute to death, to her death? I've put here unknown, but what do you think? If she was pregnant and probably not able to cross the road quickly enough, will you say pregnancy contributed to the death or not? In this case, what do you say? Did the pregnancy contribute to her death?
It's here, no.
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 Unknown.
Why? Why would you say no?
I would say the unknown is a safer
Unknown.
answer because
Mhm.
pregnancy per se slows many physiological and the physical actions of the body.
Yeah.
So I think it is safer to say unknown.
Okay.
Mm.
All right. That's also what I thought. But somebody said no.
How old was the pregnancy again?
Oh, they. Let me check. Let's just go back the scenario. No, it wasn't specified. The duration of pregnancy wasn't specified.
Wow.
Yeah.
I would go with unknown then.
Okay. But if you had said no, assuming she was let's say 36 weeks pregnant, what do we say?
Can I come in?
Yes, go ahead.
Yeah, I think in this case, an autopsy will be required because this is a polytrauma. And you might not know if she might have also internal hemorrhage. Either she had also a ruptured uterus or something might have happened to her pregnancy, which could precipitate her death. So saying autopsy was not requested, I'm not really sure, but I think if you do an autopsy, then you can have much more information whether the pregnancy has contributed or not. Thank you.
No, I think you raise an important point. But I mean, the key issue here is that yes, of course, I will just safely say, I don't know, given the information that I have. Even if she sustained a ruptured uterus, it's not necessarily that the pregnancy contributed to her being knocked. Okay, pregnancy may have contributed to her being knocked if she was too slow in crossing the road. But if she sustained ruptured uterus from the knock, it's not that the pregnancy contributed to the death, no. I mean, to her being knocked, no. So if somebody is driving very fast and so on, so it's safer actually to say unknown. But the key message here is this, and it's the same point I've raised before. Discuss, discuss, discuss. When you're completing medical certificate of cause of death, bring in your friends, especially where it is not so obvious. If it's obvious, go ahead. But the way you're facing challenges, always seek opinion of your colleagues. And then you'll come up with a more appropriate cause of death. In fact, I should have mentioned earlier that the cause of death certificate is the best opinion of the person who is filling the medical certificate. It's your best opinion. That I think I should have mentioned, and if I didn't, I need to mention it now. It's your best opinion. It's the best opinion of the person who completed the medical certificate. So to have that best opinion, discuss, consult, where it is a challenge. Okay, another scenario. We'll do maybe two more, and because I think we need to, I don't know, Nancy, what time are we supposed to end?
I think you still have some time.
Okay, we still have some time. Okay, we'll do two more. Then I
still have like an hour.
Okay, all right. We'll do that, and we can do more exercises later. Then I'll touch a little bit more on the COVID deaths. All right. So another scenario: a 35-year-old female was admitted in coma in the emergency department. She was 8 months pregnant and had had only one antenatal visit at 20 weeks of pregnancy. This was her first recorded pregnancy, so she was a PG. Her blood pressure was unrecordable, and she had a very thin pulse. She had severe pallor of the mucous membranes. According to information provided by her husband, she had had genital bleeding for more than 1 week, which at the beginning was of little intensity, but progressively became severe. A diagnosis of severe acute anemia from hemorrhage due to abruption placenta was made. She was transfused with blood, and an emergency C-section was performed, and a dead fetal was delivered. She died 2 hours after C-section. So can you look at this and form a sequence of events, and then somebody mentions it for us. So where a mother and a baby die, you make sure you complete 2 certificates. Of course, when the certificates reach civil registry, as I mentioned earlier, the civil registry normally will not issue death certificate for a fetus, for a dead fetus. They will only issue death certificate for a dead mother, for the dead mother. Okay, so let's look at the, normally also, the other thing is, there will be, there are a lot of discussions around what to write on the death certificate. Some people say you shouldn't write something like hypovolemic shock. Others also write hypovolemic shock. Others say don't write something like birth asphyxia, because these are all manners or modes of dying. Right? These are all modes of dying. But the basic principle is this. If you are generating statistics around any of the issues, it is okay to include that information on cause of death certificate. For instance, someone will tell you birth asphyxia shouldn't be appearing on death certificates, but there is WHO presents information or data on birth asphyxia. So if you don't capture information on birth asphyxia on medical certificates of cause of death, there's no way we will know how many children have died of birth asphyxia. So you'll not be able to generate that statistics. So the information that you're going to capture or how you're going to record on your birth certificate is also informed by what data, what statistics do you want to generate? If you're doing research, for instance, and you are using medical certification of cause of death, you must say, okay, I want to collect information on a hypovolemic shock. It's okay to capture that information. So the purpose should be clear. Connie, your hand is up. Go ahead.
Benson?
Yes.
Thank you so much. I just wanted to find out, because in this we have a diagnosis of severe acute anemia.
Aha.
I think for me, my thought was we would begin with shock. Okay, abruptio placenta.
Yes.
That led to hemorrhage, which hemorrhage brought about the anemia and then the hypovolemic shock.
Okay.
Yeah, thank you.
Okay, that's a possibility. That's a possibility. Let's look at what I put down. Severe hemorrhage, abruptio placenta. That's all I put. Okay. And remember the point, I made this point earlier, that there can be so many intermediary conditions. Like as Connie just rightly said, there's also anemia there and so on. You don't have to record all of them. You can just pick the key ones, especially as long as they're the intermediary conditions. Abruptio placenta, severe hemorrhage. Of course, I forgot, it was Olive who said hypovolemic shock. You can study hypovolemic shock, absolutely, no problem, due to severe hemorrhage due to abruptio placenta. Or you can also say severe anemia due to severe hemorrhage due to abruptio placenta. You can also do that. But the key things here are actually, severe hemorrhage actually is the immediate cause of death. It might have gone through maybe another hypovolemic shock and so on. There are schools of thought that don't capture information on hypovolemic shock, but you can also use it, there's no problem. But the most important thing here is underlying cause of death is abruptio placenta. So the statistic you're generating is going to be around abruptio placenta. Is this clear? You can just shout yes and we'll continue.
Yes.
Yeah.
Okay. Okay. So for the fetus, okay, you can put asphyxia, or I don't know what else you can put. Then abruptio placenta. Some people just write abruptio placenta under this and they go straight to the fetal section. Okay. Is this clear? Yes, Connie.
Benson?
Yes.
Wouldn't abruptio placenta go to other significant conditions? I don't know.
Okay. The criteria, as I mentioned earlier, is for the fetus, always the maternal condition is the underlying cause. Okay, always the maternal condition is the underlying cause of a fetal death. So in this case, it's the underlying cause of death for the baby is the abruption placenta. If the mother didn't have abruption placenta, the child would probably have died. So always make sure you record the maternal condition as the underlying cause of a fetal death, unless the cause is a genetic condition or a fetal defect that you're able to prove. But if it is something like abruption placenta, plus a rupture of uterus, things like that, those become the underlying cause of death. Prolonged labor, obstructed labor, whatever it is. Is that clear?
I'm
Yes.
still uncomfortable with putting asphyxia as the directly leading cause of death. Can't I
Okay.
just have it as abruption placenta?
You'll be right. You'll also be right to put abruption placenta. Then the issue then is how will you, especially where a country wants to generate statistics on birth asphyxias, you'll miss to capture that information. If the country is not generating any information on birth asphyxias, abruption placenta will just be perfectly fine, cause of death. Actually, there are certificates that where you just see abruption placenta as the underlying cause of death, and then straight away somebody goes to the fetal section.
Okay.
Yeah. So you'll be right. So there are two hands. I don't know which. I can't see the names because when the two hands are raised. Go ahead with your question.
Jacqueline,
Yes.
and then Assumpta.
Okay, Assumpta. I think Jacqueline has spoken.
Oh, I just
Assumpta.
wanted, thank you very much. Thank you.
Yes.
I joined late, but I just wanted clarity on that last statement because definitely, well, I don't know, that maybe I didn't hear correct because you are talking about an underlying cause for the baby's death. But I
Yes.
was wondering whether asphyxia is not the reason for the baby, the main cause, what do you say? The primary cause for the death is asphyxia.
Yes, asphyxia is the immediate cause of death.
The immediate, and then
Yes.
the underlying cause is the rupture.
Yes.
Okay, then I'm clear. That's okay.
Yes,
Thank you.
you are clear that way. Also, also what Jacqueline also mentioned is you could also as well just write the underlying cause of death, abruption placenta, and ignore any information related to asphyxia or anything else, and go straight to the fetal section to complete that section, which also will be okay. Then the point I raised is, which I mentioned also earlier, is where a country is generating statistics around birth asphyxia, if you don't capture the information because they told you don't record birth asphyxia on a death certificate, then you're not going to be able to generate that statistics because you don't have data for it. The most important thing, these are what we call non-specific conditions. For these non-specific conditions, make sure you don't record them alone. That is always the emphasis that I give. For a non-specific condition, severe hemorrhage, hypovolemic shock, respiratory distress syndrome, these are non-specific conditions that should not stand alone on a death certificate. They should always stand together with the underlying cause of death. So if you record it with the underlying cause of death, you are on track. But if you just write the birth asphyxia alone, you are off track. If you write hypovolemic shock and stop there, you are off track. These are non-specific conditions. They should always be recorded together with what is causing it. What has caused it should be included.